Guillain-Barre.
Guillain-Barre Syndrome.
Guillain-Barre or Barre Syndrome.
Guillain-Barre Syndrome.
Guillain-Barre Syndrome.
Guillain-Barre Syndrome.
Nerve cells, or neurons, send and receive messages to and from your body using electrochemical impulses. The nerve cells involved in your peripheral nervous system, which controls the ability to feel and move, have extensions called axons that can be several feet long and are covered in a fatty coating called myelin. You can think of myelin like the insulation around an electric wire. It helps to speed transmission of messages along the nerves and make sure that the messages get to the right place at the right time. The first signs of GBS are often a weakness or tingling in your legs. Think about it. The nerves in your foot extend all the way up to your brain. There's a lot of places for a message to get lost. As GBS progresses, numbness and weakness usually spreads up your body, and in some serious cases that can affect your breathing and facial muscles as well. Doctors will have to run a few tests to confirm if you have GBS, including a lumbar puncture and an EMG. Plasmapheresis and IVIG are often helpful to shorten the course of GBS and limit nerve damage. The acute phase of GBS typically varies in length from 4 to 6 weeks, with over 90% of patients moving into the rehabilitative phase within 4 weeks.
The actual cause of GBS is unknown. However, GBS does appear to be preceded by a viral or bacterial infection in many cases. Because the cause is yet unknown, the symptoms have to be treated. Recovery from GBS can take as little as 6 weeks or as long as a couple of years or even longer, depending on the severity of the symptom. The recovery process can take many forms. Counseling is a way to talk about your situation and discuss a way to achieve better outlook while you're recovering from the disease. Physical therapy can help restore movement and function to a person's full potential. Occupational therapy can help people return to a normal functioning in everyday activities. A speech and language therapist will be able to help people who experience difficulty speaking or difficulty swallowing. There have been many famous people who have been diagnosed with GBS and have recovered. For example, television and film actor Andy Griffith, NFL star William the Refrigerator Perry, and interestingly enough, a 2003 article on WebMD.com suggests that former President Franklin D. Roosevelt may have suffered paralysis as a result of GBS and not polio, as was his official diagnosis. GBS is as prevalent in men as it is in women and affects people of all ages. But with early detection and appropriate treatment, the outcome can be very positive. 95% of the people survive, and most with little or no remaining deficits.